Okay, so for the panel session, I'm going to hand over to Chris, who is the director of Elthi and also of CELSI, and he's going to run the show from here. Thank you very much, Chris.
Thank you very much, Roz. Um, it's been an absolute pleasure to be here all day. So many fascinating insights, and great to have a chance to host a panel with three really interesting and quite diverse people within the industry. So we've got Neil, who is coming in very much from the teaching side, Virginia from the materials writing and creation side, and Chris from the medical education side. So a brilliant mix. The title of the discussion is kind of imagining where we're going to be in 5 years' time. So I thought the kind of obvious way to start would be to get three different perspectives. So some initial thoughts from our three panelists on where they see AI taking us as the future unfolds. Neil, would you like to start? Give us a couple of minutes of your thoughts and insights.
No pressure there then. I think the likelihood is we will be not where we think we're going to be. All of the research in AI generally, not just generative AI, but AI as the whole kind of concept, suggests that where AI experts predict AI will have gone in a 3-year period typically is reached in half of that time, and that exponentially we're getting further ahead and quicker than any of us can predict. So I think it's very difficult to say we're going to be in 5 years' time. And I'd just like to say, A, I don't know. And if I did, I'd probably be a multimillionaire. And B, I think perhaps the question we should be asking is not where will we be, but what are organizations, institutions, governments, the NHS doing to ensure that AI use continues to be safe and for our benefit rather than anything else.
Okay. So quite a non-committal reply here. Just that we're moving incredibly quickly, so we don't know.
Yeah.
But let's keep an eye on things to make sure we're doing it in the best possible way. Okay, okay. Virginia, how about you? How do you see things
Okay,
developing over the
ditto.
next? Oh no.
However, the other thing is that healthcare itself is moving so rapidly as well. The way we deliver healthcare, looking at nursing, for example, what I was doing as a nurse last century is certainly not what people do now, and not what they will do even in 10 years' time. You know, the move towards more community-based, obviously the aging population. So I think there's a whole lot of not exactly new information, but you know, AI's got a lot to keep up with. The other thing that I'm not entirely sure about is the energy consumption of AI. You know, I think none of us have really mentioned that during the conference, probably because we, you know, like me, maybe people don't really understand it. But I mean, is it a never-ending resource, or and how available will it be for countries that don't have the wherewithal to pay for it? I mean, I think that's been one of the interesting things, you know, in the past couple of years, going to conferences, and we've sort of waxed lyrical about, oh, we'll log on to the internet, and you know, as a teacher you can use this, and then, you know, to be met by blank faces saying, well, actually, you know, our university won't provide us with that information. So, you know, I think that's another that's going to be another challenge of the ethics or the equality of distributing the joys of AI.
Okay. Yeah, I think that's a really interesting point about whether AI is going to increase the digital divide or democratize digitalization of education. Something we can talk about in a few minutes, perhaps. Chris, what are your thoughts on where AI is taking medical education?
I think it's a bit of a divide as well. Medical education is an easier area to implement AI as opposed to medical health. It's heavily regulated in medical health. We've got two AI apps now going through the MHRA regulation process. It's the first stages. And we even see these ambient scribes, these AI devices that listen to me, haven't had full regulation yet, although some will say they have. So we're going to have a kind of lag to adoption just through regulation, but also hopefully some evidence testing of whether these are safe to use. That's kind of healthcare. Education, well, we can adopt things and use them quite quickly, even though we might not regulate them. It's a bit of the Wild West sometimes. I find education writing about it. But and I think there's a bit. I've seen it before in health technology and things. And you can see the amount of money OpenAI and everyone else is putting in. That is, it's going to come to a two-horse race, and we're all beginning to see this with certain models that we're not going to be able to. They can't keep affording to like we said about the energy use, token use. So we're going to probably find some institutions buying in quite large segments. The whole publishing field in itself's been rewritten behind us at the moment. Publishing houses are creating AI search engines to remove the need for a journal, for example. So and that'll be a paywall behind that. So that there's ideas going behind the scenes about how I might go to publish a journal, which is quite prohibitive at the moment. If I'm honest, if I'm not aligned with an institution, who's going to cover my open access fees of thousands of pounds? I don't know, like you say, Chris, whether democratization or more money is a different way of paywall. I haven't quite worked it out yet.
Yeah, I mean, technology has always had those two sides, I think. So it's interesting to see how AI will either exaggerate one or bring things together. But I think the point that you make about the actual control of AI ending up in within a small number of organizations is probably something that we all need to be quite aware of. It's like looking at how many websites people use on an everyday basis is within 10 to 15, I think, something like that. Which tend to be owned by 6 companies. So there are definitely concerns around that. But maybe this is getting off the point slightly in terms of how AI is going to impact medical English education and the work that we do within this space. I mean, there's really interesting themes were coming up around the ability to use AI to replicate clinical communication. That was something that came up in yours, Chris, but also I know in Virginia's videos, for example, there are similar things going on. So I suppose an associated question around this is whether we will be able to use AI to encourage our learners to improve more quickly as a result, going to be able to access realistic role play independently of a teacher, independently of a classroom. And therefore education has become much more kind of democratized. We come back to the idea of democratization in terms of informal learning, access to education. There's so much more out there. And I guess this will kind of build into that as well. Any thoughts on that? Maybe Neil, in terms of the kind of education programs you provide in your school, do you see AI and this ability to kind of replicate clinical communication as happening within and without the school? Is it going to change the learning experience of your students? How do you see that?
I think it most definitely will. And I slightly scrunched up my face as you were asking the question for 2 reasons. I think there are massive issues where we start thinking about global healthcare education, because if we're thinking about medical English as a subset of English, then we mustn't forget the global south and the digital inequities that exist. And that does worry me. I tend to deal with doctors on a one-to-one basis, in terms of the development of clinical communication skills and also OET. So this is a self-selecting group, people who basically can afford one-to-one lessons. And what I'm identifying is an expectation from them that AI will be part of their learning experience. And if I'm unable to speak knowledgeably about AI opportunities, what is available to them, how they can take responsibility, agency for their own learning outside of the classroom, then frankly, they're put off. So I think, you know, there's a lot of talk about, will AI make teachers redundant? I don't think that is ever going to be the case, but I think there is the point that teachers who aren't able to integrate AI meaningfully will probably make themselves redundant, and that there is a need to, as teachers, integrate AI into whatever we teach. If we're working with PhD students at the highest level or postdoc students, then we need to make sure that a suitable AI digital literacy is embedded in their education, in the same way as I think we should be doing the same with teenagers on a general English program. We need to do it, but we need to know who to turn to, who to trust, and pass on those skills to the learners whilst being mindful of the sustainability issues and also mindful of some of the digital iniquities that we are perhaps responsible for promoting ourselves in what we do. I don't know how Chris, Virginia, and Chris Moore, Chris, if you'd agree with that.
Let's throw it open, Virginia.
Well,
Yeah.
I tend to look at it in the same way as the beginnings of the internet. You know, there was a lot of learning. I remember I just started a master's, and I'd been away from university learning for quite some time when I started the master's, and all of a sudden I had to learn how to switch on a computer. So I think, you know, there's always learning, and in a sense it's a similar sort of thing. We've got to learn how to use it. And I think, you know, I've sort of played around with it, I've tinkered around, but I haven't actually formally learned how to use it. And I think that goes to what you're saying, Neil, that you know, we as teachers and as writers, we have to become proficient in what our students are probably, you know, way ahead already. And that's, you know, I think but again, the dilemma is it's happening possibly faster than the introduction of the internet. And that's the thing, you know, keeping up with it. Like I said, when I gave my talk, almost, you know, every day you prepare a talk a week before, and then every day it's something you think, oh, well, that's changed it. Oh, well, that's changed it. So it's just so rapidly developing. However, you know, I think all of us agree, and I don't think it's wishful thinking, that teachers won't be redundant. They will just look a bit different.
And Chris, in terms of medical education, do you think AI, I mean, the stuff that you showed us around the interactions you had with the avatars there, do you think this is going to replace the role play that has always happened within medical education?
I hope it replaces some of it, because we do a lot of peer-to-peer role play and it's just not authentic enough. And if we can improve on that, for sure. I think it's the new phase of agentic AI. We just separate it from large language models. It's more AI that's going to be doing tasks, like people use Copilot, don't they? And I think that could become the teacher's friend, really. You're going to have your students with a Copilot who you've trained in a bit, and you need to be the human assessor. That's the 5-year view, really, is that we're going to have these learning module, like agentic modules, that will hopefully be individualized. And that's what we find in the classroom. We've got such a different variety of people, and one lecture doesn't suit everyone, does it?
Absolutely.
And if they can go away and learn, and if anyone's new to AI, just ask the AI to help you. You know, what prompt shall I write? You know, and stick to one first. I use about 5, And that's because I know each one now a little bit better over the last year. Like, for example, if no one's familiar with Claude, it's better at writing for English, for journals, for scientific journals than ChatGTP. But I've also got to keep prompting it to stop using familiar kind of bullet points, extended dashes, those things that, and it feels like I'm rewriting the AI to make it look less AI, and you can even ask the AI to do that itself. You go around in circles sometimes with prompting.
Yes.
Yeah, and there's the proximity AI, the size space. There's what was that new one that one of the US universities put out for doing literature reviews? Oh, CoStorm, and that's a real citations without hallucinations. So there's lots of new literature reviewing. Now I do a course with students this summer to do a literature review. The first, like Neil was saying, the first thing I'm going to do is actually teach them how to prompt, because that's where we're going. Google search is going to be on its way out in the next 5 years. It's rather than us for going to different websites, we'll be asking the search engine itself give us the answer, like we're doing already partly.
Yeah, my kids no longer use Google. They're teenagers and they're both using ChatGPT. Dora, you have your hand up. I'm going to allow you to talk if that's okay. Are you able to talk there, Theodora?
Hi, Chris.
Hi.
Hi. Yes, my question, because also I'm a medical English instructor, is do you think that in the future we should be emphasizing more the practice of oral skills rather than written language skills? And I'm saying that because in my class, in my medical English class, I have dropped asking students writing assignments anymore because firstly, we have a lack of institutional policy as of an explicit institutional university policy as to what extent AI tools should be used or not, and secondly, because no matter, I think maybe it was my mistake. I tried to train students as to how to critically and ethically use AI tools. Whatever came back was pretty much the same. So on the one hand, my question is whether we should be emphasizing more oral language skills, considering that the availability of all these AI writing tools will be freely available and everyone is turning to them. And also my second question is, do you think that the students' voice is sort of getting lost, if I want to say, I don't know how to phrase it correctly, but all the papers I got back from my students, they were all written in exactly the same tone register, which was obviously not their own. So I'm afraid that we're missing that, and I don't know if it's good or bad. I'm just wondering, and I wanted to hear your thoughts.
It's a really interesting question, Dora. So is writing becoming redundant, and is writing, becoming flattened, if you like? So we're losing the individuality within what we've always, sort of seen when we see writing submissions. Chris, I mean, do you see this in your training courses at all?
I certainly see less need to write, and the writing we do is often quite truncated. It's abbreviated and it's not full English. And I think the PLAB exam now coming to the UK, if you want to pass the exam to be UK doctors, the multiple choice exam, the NOSCE, they don't do a full written paragraph like they used to. So that's certainly a shift. I spot the AI stuff when students work because I mark a lot of work. I do comment on it, but it's hard to fail them because there isn't strict guidelines yet to say you can't. Only certain universities are saying you can't. Oxford, for example, have got several courses they're promoting AI use. One interesting study that's just come out is the ability to critically reason. So if you give students AI from the beginning and they can do all the reasoning, right stuff, take it away, they can't do the reasoning. Us has spent decades reasoning, we can use AI, interpret stuff, take it away, we're still okay. So I do worry a little bit we're going to take reasoning out of students. But then again, someone said, well, we haven't taken the computers away ever, have we? The internet hasn't died overnight. So why will it go away? So there's two sides to this, I think. I don't know what others think.
Yeah. Neil, what are your thoughts on Dora's question there?
I think it was really interesting, Dora, when you made the point that the university didn't have a policy, and I think that's possibly reflects in what's happening within the institution, and that the students are going to take the route of least resistance, which is use of AI. So, I mean, I would absolutely encourage everyone here today to ask of the question, does your institution have a policy for the use of AI? And if it doesn't, can I suggest that you need one yesterday? Which then raises the issue of how do you go about doing it? Well, talk to your peers, have critical friends if you're in universities, look and see who else is doing what. I mean, the Russell Group, for example, came out with a statement on AI, which I don't think has been updated, back in 2023. In terms of pushing oral rather than written skills, I think it comes back to the point that was made a lot of times this afternoon about the importance of the needs analysis. There seems to be little point ramming writing down students' throats if they're not going to need to write. Although I question whether they will never need to write. It's actually finding what kind of writing do they need. But I'd also come back to it from another angle, which is saying, well, if we accept that the written voice is important, and if we can identify where students will need to develop it, what kind of texts are they going to write, then, I mean, I'm working on a 4-stage model at the moment, which looks at the way in which organizations harmonize their AI digital guidelines and their policy with their assessments, and that the two dovetail. Because I think there is a lot to be learned from the use of AI as a writing buddy, for example. But we have to train students, as well as the AI GPT model that we're using, to do that effectively. But likewise, I think we need to start thinking about how we're assessing students, because if we don't change our assessment policies to make the most of AI where it's appropriate to do so, and where to rule out AI at all, if that is an important factor, i.e. going back to written questions with answered by hand, and there will be occasion where that's useful, then I think, we need to be having these conversations. It's quite a long-winded answer, but quite a complicated question, I think. And Dora, thank you for asking it.
Yeah, no, really good question. Virginia, what are your thoughts on the question?
Well, to one, I agree the issue of the individual voice not coming out, and that's as I said in my talk, that's my problem with writing a dialogue that I want to have a bit of personality, and if I just put the AI prompt in fact I did it 5 minutes ago, and again what comes out is, hey, what do you know about Cushing's disease? Oh, well, I've heard. It's not at all, and the prompt was care of a patient with Cushing's disease, and it was sort of, it's very difficult. I think it will be a shame if we lose that individuality. The second point is, I agree with Neil, and I don't know whether you were sort of vaguely alluding to a certain test that has written assessment is not what's reflected in practice.
It wasn't, but it's a fair point.
Oh, yeah, because I think that is there any point if you're looking at medical nursing or anyone in the healthcare field, is there any point of assessing their ability to write an essay when they go into the workplace? The writing that they will be doing is minimal, and a lot of it will be ticking boxes on a clinical pathway. Reading is probably more to the point, but but then there's the dilemma of that they have to be tested at a certain level, and how do you do that? How do you test their writing ability to an acceptable level without getting them to write? So I think, I agree with Neil. It needs analysis. What exactly what do your students need to gain by doing the particular course that you're delivering?
Absolutely. Okay, well, that's some very good answers to a very good question. I want to come back to something that Neil talked about a few moments ago, and that was about how teachers and AI will remain kind of coexistent and will need to work together because there are fundamental differences between the two. And I was wondering whether you could elaborate on that a bit, Neil, and probably that merged into medical education, given the presentation that Chris and Zeffie and Theo made as well, which looked at how doctors the clinical communication given by physicians was rated as worse than that given by AI. So again, a really interesting study. So I'd like to sort of dig into that a little bit. Neil, do you want to talk about the teaching side a little bit, and where you see those differentials as kind of playing out?
Healthcare, to this point at least, has always been a human to human endeavor. We've had the development of operations that happen remotely, but at the end of the day, there is a human at the end of the operating arm. And I think care has always been synonymous with compassion, with empathy, with not just a knowledge base, but a emotional, sometimes perhaps almost a spiritual element that overlays the clinical training, the knowledge base of this patient has this ailment, this disease, this is the treatment path, but it's the human touch as well. And I'm not convinced that all of that will be able to be replaced by AI, at least as we understand it at the moment. And that was perhaps what was behind my question to Chris and his team when we were seeing Emily, because I was really impressed by the way in which, and apparently it's 11 labs, that voice was so real. And I think Virginia, you commented, either Virginia or Ros commented on the same thing. I've been looking at this whole concept of AI's ability in terms of speech to rate empathy, compassion, and to match it. The so-called Hume.ai has been doing a lot of work in this area. And it's still very clunky, but it will get better. I'm just not, and I don't think I'm a technophobe or a Luddite, I'm just not sure how far it's going to get. Now, I know there are lots of teachers and AI trainers, George Pickering from the British Council, Nick Peachy, who are all suggesting that, in fact, the teacher's role is going to change fundamentally much sooner than many of us think. I don't actually subscribe to that. And I think in healthcare education, it's an even more critical path that we tread. I think AI, for me, well, over history, technology has always been the thing that's going to stop the teacher. And when I use the word teacher, I want to expand that to the word educator, because education is so much richer than knowledge transfer and knowledge banking. It's about understanding your learner. It's about understanding what makes her tick. It's about understanding how to encourage that learner, when to motivate them, when to get the carrot, when to get the stick. And I think those empathic moments are really what defines and differentiates an educator from someone at the front of the class with a board pen or in the past a bit of chalk. How quickly will AI get there? Will it ever get there? I'm not convinced.
Well, I should really throw that open to Chris, because of the empathy study that came up in the research that was presented, did imply that the empathic skills of AI were in some cases better than those of healthcare professionals. Chris, what are your thoughts on that?
Yeah, so it's mainly emergency medicine in the States, and I think it just reflects medicine in general that we've got to remember the patient journey to getting to you, and it's quite an unconnected journey, often not a lot of humans. So even if the AI is generating a statement where it's a bit blunt, thanks for waiting, thanks for that, it's maybe enough sometimes for patients just to feel like a little bit heard. Yeah, we teach all these kind of empathic skills, but if we're a rush doctor, they often, we forget about them. It's a quick A, B, C, D approach, emergencies, etc. So I guess it's depending on what we mean by the degree of empathy and what we are tuning it to. I think if we're thinking about a very challenging conversation, bereavement with a patient or family, or it's complex with different opinions, clearly the AI is just not going to be suitable for that currently. But if it is just little brief moments of kindness that we sometimes lose as humans, then I'm all for it. If the patient's experience, if we think about it, ultimately the patient experience is positive, then I need to have that support at times. And if it helps the doctors burn out less, generally, and nurses, I think if that's saving me time having an ambient scribe, I can spend a bit more time looking at my patient and talking, then I've got to see that as an advantage. And my English is better written, if I'm honest.
Yeah.
Actually,
Okay. Well, that's also an interesting point. I mean, the time element, I guess, is critical there. But how much time doctors are able to spend with patients compared, and if we compare to teachers do have more time, generally speaking, than doctors. So maybe there is a differential there. Sorry, Virginia.
I was just going to say, on another sort of positive note, I was reading about a study. It was to do with loneliness, and loneliness is really one of the big health issues of the day, and providing people with a robot that something rather than someone that they can who's around, who they can talk to, who alleviates that loneliness. I mean, again, that's got to be beneficial. It's not ideal. It's not a person, which would be the best option, but surely it's better than someone sitting in a room on their own.
Yeah.
So there are. It's not all doom and gloom, and hopefully there'll be very clever people who take it forward in a good way. And I guess I'm always an optimist, so I'm hopeful that will be what will happen.
In terms of your writing, Virginia, do you feel that having access to good quality AI tools will actually improve what you can do, but it'll accelerate, it'll amplify, but you will also still provide the sort of Virginia touch, if you like?
Well, that's what I do now. I mean, I'm trying to get better at my prompts, so that I don't get the awful, hey, what have you heard about Cushing's disease result? It is getting better, but there's still a lot that I do, but it's because I want to do it. I don't want to produce something that sounds the same every single time and that finishes with hey, we'll always be here for you, which is seems to be the default ending. So yeah, I mean, it's slowly helping me a little bit, and I'm hoping it will help me a lot more. But it means I've got to learn too. I've got to put in the learning and become a bit more proficient.
And do we feel that AI is going to stop hallucinating soon, or is this going to be an ongoing kind of unreliability? What does anybody think about that?
On a technical note, I understand, although I've never actually managed to alter it, this is to do with the temperature setting. That the lower the temperature setting gets to 1 and below 1, the less likely that AI will hallucinate. And I think this also speaks to the generative AI tools that as teachers and as educators and as healthcare educators we're using. And we've heard a lot today about ChatGPT. We've heard a lot today about commercial apps. Beata gave us that amazing insight into the tools that are available for pronunciation. What I think is the next big step is where teachers start engaging with bespoke AIs, either getting behind the back of ChatGPT, Gemini, Claude, whatever it is, and training their own GPTs for a specific use. Let's remember that for every particular use we have, we will probably have a different GPT. We won't use the same one for reading as we're using for listening. We certainly won't be using any of those for training empathic discourse analysis in the case of treatment of giving bad news. There are platforms like Mizu that are out there that can help us, but there it's not always clear what Mizu is actually working on top of. It's probably ChatGPT, but I think that's the next step where we're better able, because we've had better education in bespoke GPT development, then and also let's not forget, we should always give ChatGPT and others feedback. When it's done well, say so. When it hasn't done well, tell it why and what we expect better next time. So I think it's that training of the GPT that might lead us towards less hallucination, but within a much more narrow field for which that GPT has been trained as a bespoke tool.
Yes, absolutely. Yeah, my feeling is that AI is becoming much more will become much more targeted, much more tailorable. And I think when it comes to education, that's also an interesting thing to imagine, that AI will become very personalized, and people will have almost like personalized AIs who will take them on their own learning journeys, which are either directed by a teacher or directed by themselves. Yes. Chris, do you have any sort of thoughts either on the more sort of individualized AIs that are being developed, or on the reliability of AI and the content it produces?
Content's always a little bit dodgy. Hence that's why you need to be somewhat of an expert in your field to kind of review it. And that's where students go wrong, because they're not the experts. So they just put it out there as if it is the truth. And then also you've got to be aware that some of the models are only to the internet, say, till up to 2023. There's like a gap. So you've got to be careful. There's always a gap of knowledge when you use language models. I do think it'll be device-based. DeepSeek has shown that we can now get a bespoke language model on your computer with your own chips. We don't need massive servers. What they did was quite creative. So I think that's what they're working on now, is better chips for our computers and models that will fit on a device. So then it will be all localized. Particularly, I think that's better for data security. I demonstrated with SimFlow, it's a closed loop. It can't learn from you. So if I was to disclose I'm a doctor at Swindon Surgery, the AI doesn't suddenly learn that about me. And we kind of want that in education as well. We don't want personalized details just to be broadly known amongst people we don't know. So I think there's all those ethical issues that I'm sure regulators are thinking about at the moment.
Yeah, absolutely. Virginia, any thoughts from you?
Well, no, I just repeat really what has been said. I think it's there's a lot. There's still a lot to do, and I think the patient confidentiality and data security is obviously a huge issue that must be nailed down.
Yeah, I mean, as a writer, are you concerned about any intellectual property issues that AI might be exposing?
It's difficult because I mean, there've always been problems with. I think of the Cambridge English for Nursing books, that there were, as soon as they were published, there was a certain amount of plagiarism. I mean, you can't. As soon as you put pen to paper, it's always, you know, it will always be an issue for writers. It always has been, and it always will be. But I think there are more, you know, there are ways now of checking on plagiarism, and I think there's a lot less you know, it's absolutely unacceptable, and you know, that's, I think that's the best you can, do. I just continue to write, and you know, sometimes I think, well, what is it? Imitation is a form of flattery.
Flattery. Of being ripped off.
I mean, I guess for me, my aim in producing short dialogue videos is to help nursing students and other students to you know, to improve their communication skills. So if I can do that, that's great. If someone, it's a shame if someone passes it off as their own, but it won't stop me doing what I do.
And you wouldn't mind if someone asked an AI to create an English for nursing course and it drew heavily on what you have put out there?
Well, I mean, again, if they said it came from me, that would be nice, but I don't know that I would have much control over it. I mean, what would I do? Where would I go? Where would I go to complain? It's, again, I think, you know, this has been the dilemma for writers. As soon as you put a thought to paper, someone can steal it from you.
I am aware that we're drawing to the end of the panel discussion. Does anybody attending have any questions that they'd like to put to the panel? Okay, I'm going to take that as a no. Any closing thoughts as we draw the panel to an end? And Neil, anything from you on anything that has come up in the last 45 minutes?
I think everyone here today will have learnt a huge amount, even though probably we're a self-selecting group, we're probably in our own way edging towards experts. So can I just say, can we make this a regular annual event, please? Because it has been so beneficial. And with AI moving so quickly, what we're talking about today and what we might be talking about in a year's time, you know, we need those updates. And I wasn't paid to say that.
Well, if you want to organise the next one, Neil. No, I mean, absolutely. Yes, an annual event, given the pace at which things are travelling, that does make a lot of sense. Chris, any final thoughts from your side?
I just think, like we've all said, it's AI is augmenting us, I hope. And perhaps like Theodora's asking about, should we do like written English, and we're changing that, but maybe we just got to go back to the reasoning side of things. Like take a kind of written paragraph or a verbal paragraph and now concisely give that into medical kind of shorthand. You know, that's the kind of expertise level that we've got to still train people at, that the AI won't necessarily do that well. That's how I look at it at the moment, because when it does my notes, it does it almost verbatim, and I ask it to make it concise, and it just keeps still like it's like a half a page. So it isn't there yet. That's my view on it anyway.
So using it for what it does well, and then really focusing on what we do well
as
well.
teachers. Yes, reasoning is the important part, I think, of all this, because it can't reason.
Good. And Virginia, final words from you.
Agreed. Lots of different perspectives. I agree. I think we all have learned a lot, and I think it's been very interesting to have Chris giving the medical education viewpoint. That's been very interesting. And I mean, I always say something on a tangent. Recently, I've gone back to Duolingo just to keep the old brain ticking, and I decided I'd go back and learn Latin that I did at school. And I'm very pleased to have heard that in Czech universities, and I believe in Hungarian, that Latin is taught in the medical faculty. So well done.
It is. Yeah.
Yes, I'll be trotting along and joining your courses.
My party piece, I will sing Old MacDonald Had a Farm in Latin at the end. For
Well, I'll use that, Neil.
So,
And thank you very much to for everyone who organised this. It really has been a day well spent.
Hear, hear.
Great.
Right, excellent. Well, on that very positive note, we will draw the panel discussion to a close. And just a huge thank you from me to Ros and Petra, who didn't make it, unfortunately, because Petra's not well. But both Ros and Petra behind the scenes have put an enormous amount of work in to make this day happen. It's been a really good day. Great variety of presentations, some really excellent insights, some really interesting work being done, some really interesting research taking place. A lot of us, a lot of things for us to think about, to talk about once we close the webinar, and to continue to work on in the areas that we are focusing on. So a huge thank you to Ros and to Petra for putting the whole event together. And thank you very much to everybody for spending your time, for giving up a Saturday to be with us. It's really hugely appreciated. Elthi is really committed to the ongoing professional development of people working in this very unique, very special space. And we're delighted to see a lot of people coming and going throughout the day, but a really good regular attendance throughout. So that's been, the levels of engagement have been strong throughout. So we're really delighted to see that as well. Ros, a final word from you, perhaps.
Well, I don't know. Something completely off topic, but when I went to, but not off topic, at lunchtime, I logged into my email account, and there was something from The Connection, which is a French newspaper for foreigners, basically, who go and live over there, expats who go and live over there, and it warned us of the fact that AI was being introduced into in Paris, I think it was, detecting anybody who was putting the wrong waste in the wrong waste bin. So
Right,
from face recognition, I mean, I don't know, that's it's off topic, but it's on topic. Anyway, I want to say thank you so much to Chris and Zephy and Theo for an excellent keynote speech. Really, really had us all thinking and overthinking and not worrying at all. But and thanks to all the other speakers who participated and the panelists too, and to the delegates, thank you so much for sticking around. As Chris said, we had a good number of people all the way through. It was really worth putting it together, and I'm sorry that Petra wasn't able to enjoy it as well, but she was definitely very strong in the background there, helping me put it together. So thank you to her. All right, well, thank you very much, and
Thank you.
stay in touch.
Everyone.
All right,
Yeah.
thanks everybody.
Thank you, everybody.
Thank
All
you.
right, have a good rest of the day. Take care. Bye.